It's so funny because when I edit these, it's always like, no, you were live. Like you can tell, oh, we were live, but like we
Uh-huh.
didn't know because the other screen says no. Well, hello, everyone. This is Dr. Jennifer Gardella, and I am here with our fearless leader of BCHIP, Kim Everett. Kim, how are you?
I'm good, thanks. Excited to be here with you and talking about some more good work that we're up to.
Yeah, so we today want to talk about two things. The first is that BCHIP is hiring. So we know that the job market is super tight out there. Why don't you tell us about the position?
I appreciate that. So yes, BCHIP is hiring. We have an administrative assistant role that we are looking to fill. It's for 30 hours a week in our BCHIP office in Newtown. It's flexible in the scheduling in that it's between general office hours. It can be anywhere between 8 and 4:30, taking those 30 hours and spreading them out over the course of 5 days during regular business hours. And we really need someone who is proficient in QuickBooks, which seems to be the biggest challenge because we cannot seem to find anybody that is proficient in QuickBooks. You're laughing, but that's a thing.
No, I'm laughing because as you well as you know, I own a small business and I have paid for a QuickBooks subscription and I have been QuickBooks averse, which really means I'm too lazy to learn how to use it. And so I've been doing everything on my spreadsheets. And just this weekend, I sat down and got in there. And so, yeah, very important to be able to maneuver through QuickBooks. Okay, so
Well,
someone,
good.
are
Once
you?
you master that, you can come work here as our administrative assistant.
I would love to. I would love that. Because we'd get nothing done. We'd
No,
just
we
be
would
on
get
Facebook
nothing done.
Lives all day talking about pizza. Okay, so they have to know how to, do they know have to know how to use QuickBooks already?
That would be our preference, honestly. And I think that's really been the challenge for us. We don't really have the resources to do a lot of, training per se. I mean, we certainly need to onboard someone to BCHIP and our policies and our processes, but to have to teach somebody QuickBooks would not really be a position that we're in. So we're
Okay.
hoping someone comes in proficient in QuickBooks. So if you're interested or anyone's interested in that role, Doylestown Hospital is our HR manager. So they can go to the Doylestown Hospital website and apply. Again, it's the BCHIP, Bucks County Health Improvement Partnership Administrative Assistant role. It's also posted on Career Ready Bucks. So if they wanted to go to careerreadybucks.org,
Oh, yeah. Okay.
the position is posted on that as well. So we're hoping that we'll be able to find someone. We've been looking for a while, so I'm glad we were able to talk about it today. I was really surprised at the market around having somebody proficient in QuickBooks. So
Interesting.
yeah,
So, what kind of personnel besides QuickBooks? What else are you looking for?
just general administrative role,
Okay.
administrative assistant role, able to attend some meetings, take minutes, produce those minutes, communicate with we have a hired bookkeeping and accounting firm, so someone that can communicate with them and keep track of invoicing and making sure everything's processed as need be. And they're in charge of ordering and processing what we need internally as well. So it's an important role for our team.
And the staff is lovely there. So there's not a
I
lot of
think so.
drama. It's sometimes you guys are really busy, but that's kind of good, right? I mean, who wants to slug around at work? So sometimes it's a fast-paced environment and a great place to work. And you get to work with Kim. Who wouldn't want to work with Kim all day?
We do have fun, but we do work hard. You're absolutely right. Our
Yeah.
administrative assistant also is really critical, plays a critical role in planning our annual event as well. So there's a little bit of event planning in there too. So,
I love that event. I
we
had
have
to
fun.
miss it this year. I was so disappointed. Okay, so if you're interested, I'll make sure that the link is below this video so it's really hard to share a link to the hospital website for jobs, but we'll get you as close as you can. And then, like Kim said, if you search on BCHIP in the hospital system, the position will definitely come up.
Yeah, thank you.
Great. And then the other thing we wanted to talk about, and I am reading this off of my screen so that I do not mess up the order of the words, is the Direct Care Worker Grant. So
Mm.
this is offered through Bucks County, correct?
And through BCHIP.
Through BCHIP.
So we're really fortunate. There were over 80 applicants for this grant, and Bucks County applied with, so it's the long-term care provider. So we had nursing homes write letters of support, BCHIP bringing the long-term care partners together as well as the health systems, and then our Bucks County Workforce and Economic Development team. And so we submitted a very comprehensive proposal, and we were one of 8 selected for this grant. It's a $600,000 grant for Bucks County. And the purpose of this grant, we know that workforce is a real challenge for our health systems and our long-term care providers, meaning our nursing homes, personal care assistants, those roles, even home health aides, right? So when I say it all the time, when people think of healthcare, they think of nurses and doctors, right? Maybe they think of a tech, but
Right.
they don't think of all the other roles that are so important. And so this grant provides funding for people to be certified as a certified nursing assistants, so CNA, or they can get on the job training to be a personal care assistant or home health aide. And so it's meant to serve the needs of the nursing homes or the hospitals or home care agencies. And what happens is if an employer has someone now who say works in dietary and they want to upskill and they want to now be trained as a CNA, they can participate in this program.
Okay.
This grant will pay for their CNA training. It will give them a stipend that if they need help with childcare or transportation or a computer or scrubs, each employee can get $1,000 of what's considered supportive services while they're in the upskilling phase. And then I'm looking at my notes too, so I can make sure I refer to the right
We
amount.
like to bring factual information here on our
Yes, we don't like to
calls
make
every
it
other
up as
week.
we go. No, we try to make sure we know we're saying the right thing. Then each employee that participates will get a 6-month and 12-month retention bonus. So if they're hired, if they're already an employee there, but they stay in this new role for 6 months or 12 months, then BCHIP is managing those funds and we provide a retention bonus to the employee. And then we also have funds in here to help with upskilling other employees. So for instance, one of our long-term care facilities, they know they need folks better trained in helping patients with dementia and dementia care.
Okay.
So if there's a cost for them to bring in training for that, then we have grant funds to do that so that they can better meet the needs of those patients and provide the training for their staff.
And so how do you apply for this grant?
So there's a few different ways. So if you're already working in long-term care, just talk to your HR department if they're in Bucks County, and they will reach out to us. Someone can enroll directly. They can just go to Career Ready Bucks, and we can put the link too for this grant. It's also on the Bucks County, the County of Bucks website in their Workforce and Economic Development group. So somebody themselves can just sign up. So if someone already had an employee, like I said, they can do the upskilling, but say you're just someone out there right now that is looking for a way to get involved in their community. If you want to help other people and you want to be trained, there would be no cost for the training. We'll help you with job placement once you go through the training or even possibly during. And you just can enroll through careerreadybucks.org.
It's phenomenal. And there is a feeling, I have 3 20-something-year-old daughters, and in talking to them, they feel that the job market has really tightened up, that this idea, even 6 months ago, there were tons of jobs available, and now there's no jobs to be had. And I keep saying to people, but there's jobs at healthcare. That's what Kim tells me.
There's jobs in healthcare.
And now there's money to get you jobs in healthcare. So this is a great time if you are in a position, and like Kim said, if you want to level up your skills. What a great way to say that, by the way. Or if you want to make a switch from whatever it is that you're doing to a job that maybe is more secure, or, we've always talked about, these jobs, like if you want to help people, right? If you want to get into a field where you're actually helping. I did have one question, because I always have questions, but
Of
if
course.
you do want to become a CNA, how long does that training take, and where does that training take place?
So that's a great question. So the Bucks County Community College, we are partnering with them.
Okay,
They do have courses available, and we're trying to get some folks enrolled pretty quickly to be able to start in the next few weeks for the fall program. We have a couple in there already.
great.
Other organizations, when you're hired, they have their own cohort where they internally can do a CNA training. They're certified, like the facility itself, to offer a training, or they partner with somebody to bring in and do that.
Okay.
And then there's a few other programs like a med certs program and things of that sort. So when you enroll in the program, we would help you find the best fit
Great.
to where you should enroll for that program.
Awesome. Yeah, by the way, I'm not enrolling in the program. I just had a question about like where does all this training take place? But
Mhm. It
I hear that
depends.
Bucks County Community College has great professors. I happen to be one.
I wonder why you might be commenting on that, Dr.
I
Gardella.
had to go there. Okay, so that's great. So, Kim is always saying that there are jobs in healthcare. So if you're out there and you cannot find a job, maybe it's time to make a little bit of a change, right? And get some, and who doesn't love school? I mean, I totally love school. I get a lot of people don't like school, but it sounds like there's a ton of support for you out there if you're looking at when you're looking at these programs. And I will also say this, a little to the left of what we're talking about. Bucks County is doing so many good things at the county level. They have a program right now that's for business owners. They have this one. They're really trying to, strengthen the ecosystem, I
Yes,
believe,
I
of
agree.
workers, employment, businesses, to build it up a little bit. And I think that that's just phenomenal. There's funding available, and our people at the county level are going after it, which is
They're
great.
doing a good job. And that's really at the direction of our county commissioners. So we're fortunate that they're recognizing the needs and working really hard to fill those gaps where they can.
Okay, so if you've hung in with us this long, you know that Kim has a job available and she's lovely to work with. And you also know that she has money available to help you get training to get an even better job than what you got if you want to switch careers or stay in your field, but do something new in healthcare. So, Kim, thank you very much for your time. And we will see you in 2 weeks. Who knows what we'll be talking about then?
Yes, thank you so much.
Bye, everyone.